Hello, this is Mark Allenbaugh, and welcome to SentencingStats.com. This is our COVID update for December 7th, 2020. We haven't done one in a while, a lot to cover, but we'll try to make this quick, approximately 10 minutes. So the BOP now is at record active infections. 89 of 193 BOP facilities are over their rated capacities with an overall average 97.6%, which is rather high in a pandemic. Only one of 11 private facilities, however, is over capacity, and the overall average capacity for those 11 facilities is just 74.6%. Point being, the less dense, the less populated any particular facility is, obviously the better in terms of combating COVID-19. This chart illustrates it's a trend chart showing the number of active inmate infections, active staff infections, and the total inmate and staff deaths, which unfortunately right now is 163. You will see that BOP is now within a third surge, a very significant one and the highest yet, just consistent with or paralleling what's going on in the rest of the country. What is notable about this, and we don't have an explanation directly for it, but is the difference between the active staff infections and the active inmate infections. The reason why these tend to go down is ostensibly inmates are recovering. Again, this is active infections, not cumulative infections. But here with staff, they do not seem to be recovering. And right now, that's a significant amount of staff that are actively infected. The BOP reports various numbers for the number of employees it has at various parts of its website, but on the coronavirus portion of its website, it's consistently reported exactly 36,000, and that number has never changed for whatever reason. But assuming that number is correct, with 1,500 active infections, that's a significant infection rate that should be troubling to all. What this chart illustrates is, unlike this chart illustrates is the active infections, but the total active infections. Here we are not taking out the inmates and staff, we're combining them together and comparing it to the overall inmate population for BOP facilities, as well as private prisons and RRCs, combined all of those. As you can see here, the BOP's overall prison population for these facilities has dropped almost 20,000 since mid-April, but during that time, as we can see here, the active infections continue to climb. So the takeaway from this is apparently they're not removing inmates quick enough to combat the virus. And certainly having 90 or almost 90 of the facilities over capacity certainly isn't helping, even though the overall population has decreased. What this chart shows is now the cumulative. Here we've taken all of the inmates that the BOP is reporting as actively infected, plus recovered, plus dead. This is the common way that states and the federal government report cumulative infections elsewhere. So we've applied that methodology here, and it's also inclusive of the private facilities and the RRCs. And you can see these obviously have continued to grow and have accelerated over the last couple of months. So now there's a total of 31,855 cumulative inmate and staff infections. Again, a very significant and shocking number. But what we've compared it to here is the rate or the number of inmates that are currently on home confinement, which the BOP touts as one of its primary methods for combating the virus. Obviously, when you take an inmate out of an institution and place him in home confinement, that reduces the population and the population density, and thereby reduces potentially the spread. The problem, though, is that number of inmates on home confinement hasn't increased much. There was a large bump back in early July, and since that time, barely 1,200, maybe 1,300 inmates have been released or are on home confinement. 1,300 more inmates now than in early July are on home confinement. So it does not appear that they are released or placing as many inmates on home confinement as they otherwise appeared, or as they claim to be, or as they want others to believe they are. We don't have a chart for this here, but we have looked at the number of monthly releases of inmates from prison who have completed their sentences, and that number hasn't demonstrably changed. So there's reason to believe that this is an accurate reflection that, in other words, the BOP is not releasing as many inmates or transferring them to home confinement as they would like those on the outside to believe. This chart here tracks the rate of the positivity rate, and it's not a perfect analysis of the positivity rate, since the BOP does not appear to timely report the number. It doesn't batch its tests. In other words, it doesn't report the total number of tests, and out of that batch of tests, how many were positive. So what we've done is just we have essentially a running percentage of the total number of tests they've reported to date, and the ratio of those total tests to the total positives. And that indicates that there's a positivity rate under that methodology of 31.29%, which is significant. What these numbers here show are the number of daily tests performed as the BOP reports on its coronavirus dashboard, and the blue here is the number of positive results it's reporting each day. And as you can see here, these are just 14-day trend lines, and this orange trend line is kicking up. They're reporting more positives, which is not surprising given the increased number of active infections that we're seeing. So this chart, we're almost finished here, shows this is another troubling artifact, or maybe it's not an artifact, that we have discovered in the BOP's data, and that is that the total number of inmates that have ever tested positive, which is the way the BOP reports the number of positives on its site. It indicates that number is to represent all the inmates who have ever tested positive, which is this orange line, and as of December 4th, it was reporting that there were 25,821 inmates who at one point in the past, at any time in the past, tested positive. The problem is that the BOP, when you add up the active infections, the recovered, and the dead, and this is inclusive, by the way, of private facilities, we get 28,219, so about 2,500 more. And it would only be speculation on our part to try to explain what that difference is, but nonetheless, that it has grown from 400 back in mid-June to 2,500 now indicates that there's some type of accounting problem going on, and we believe it's just worth bringing this to everyone's attention. And finally, just to place the number of dead in context here, the number of inmates who have died from COVID-19 so far, and there have been also 2 staff, or at least 2 staff that the BOP has reported have died from COVID-19. We're used to hearing numbers of thousands at the state level, and unfortunately hundreds of thousands now at the national level. So 161 doesn't seem that much in the grand scheme of things, but it is when looking at the BOP specifically. So this is the number of COVID deaths so far, 161. When you annualize that out, in other words, if you project to a full year at this rate of death, within approximately late March, which is when the COVID was first identified in the BOP, we're projecting 227 dead. On average, the BOP only experiences a total from all causes, 374 deaths a year. So that is significant. Just right now, the COVID-19 is going to increase the average number of deaths in the BOP by about a third. What's significant here, we've also compared COVID deaths to the total number of deaths by accident over a 16-year period. This is not an average. This is the total amount of deaths from accidents within the BOP over a 16-year period. There were only 81. COVID-19, in less than a year, is responsible for almost twice the number of deaths, and it'll probably be higher after a year is up, than the BOP experienced over a 16-year period. Same with homicide. For over a 16-year period, there were only 160 homicides. COVID is actually now more than that, than the number of deaths. COVID-19 equals the number of deaths that the BOP experienced from AIDS total over a 16-year period is reported here. This is the citation for the source that we rely on up here. And from suicide, BOP over a 16-year period only experienced 260 over 16 years, and less than a year, COVID-19 has already resulted in 161 deaths, which we believe may make, and likely does make, COVID-19 the most deadly event in the history of the BOP. So that wraps up our sentencing stats update for December 7th, 2020. Thank you for your time.